Hello, everyone. My name is SHAKALA ALVARANGA. I'm the Director of Public Programs at the Mob Museum. Thank you for watching our Community Safety Forum virtual series. We hope that this virtual forum has helped you and your family during these trying times. December is National Impaired Driving Prevention Month, and ahead of the holiday season, we want to share an important and powerful message.
It's an opportunity for us to remember not only the thousands of people that we lose each year to impaired driving, but also renew our commitment to tackle this issue. You know, before COVID-19, I oftentimes referred to impaired driving as a public health crisis because we're losing tens of thousands of people to this cause every year, and it's something that's so preventable. It's a choice that's made, and it's a choice that can be prevented. Last year, we lost over 30,000 people on our roadways, and about 1/3 of those were due to some sort of impairment. According to the Center for Disease Control, we lose about 29 people every day in our roadways to impaired driving. So if you average that out, that's about once every 50 minutes we're losing someone. And again, it's something that's so preventable. So during this special season, a season that's hallmarked by the holidays and a time of gatherings, friends, special moments with New Year's and new beginnings, we want folks to remember to take the responsibility that they have, take the obligation that they have to keep themselves and others safe while making a plan. If they're going to be behind the wheel and impaired, that's not acceptable. So to make a plan, find a friend, use a Lyft app or an Uber app, whatever it might be, but to make a plan to get where they're going safely and keep themselves and all users of our roadway safe.
Rick BIRT, the CEO of SAD. What does SAD stand for, and what is your organization's mission?
Students Against Destructive Decisions. We've been around for almost 40 years. Many people will remember us as Students Against Driving Drunk. Started back in the 80s out of a tragedy in New England after a community lost several young people in a series of alcohol-related crashes. Our students came to us many years later and said, hey, we still think impaired driving is a critical issue, but there are so many other issues that we want to talk about. So now we serve as a national network of about 7,500 chapters in elementary schools, middle schools, high schools, and colleges, focusing on traffic safety, substance use, mental health, and leadership development.
Can you tell us more about your partnership with NHTSA and the December report as well?
So as part of our efforts to draw attention to the issue of impaired driving, we've partnered with the National Highway Traffic Safety Administration, or NHTSA, to release a federal report on the status of impaired driving, specifically looking at that 18 to 25 age bracket, those college students who oftentimes are in new settings, experimenting with drugs and alcohol in a way they maybe didn't in high school. And now they're having to make a decision on how do they get home? How do they head home as a pedestrian that's impaired? What do they do as a driver, as a potential driver who's now impaired? So this report does several things. Number one, it looks at the literature and the data to show us that the issue of college impaired driving is on the rise, not just in residential campuses or traditional four-year institutions, but also in commuter schools and community colleges and trade schools, where our students are less residential and more transient in their everyday behaviors. And we found that, number two, there's very little programming that talks specifically about the issue of impaired driving. So we make, number three, recommendations to our partners in the higher ed space to infuse impaired driving curriculum into what they're doing already. There's a lot of talk, particularly in traditional four-year institutions, about binge drinking, underage drinking, being a social bystander. There's not a lot of education on how you can get home once you've made that poor choice to be impaired or to put, again, prevent another tragedy from happening. So that's one of the things that we're doing. We're sharing this with our college partners, with our partners in law enforcement, see how we can build relationships and really highlight this age group, which is one of the fastest growing in terms of number of impaired driving crashes and collisions.
Diego Trujillo with Las Vegas Heals. Diego, thank you again for joining us. What is Las Vegas Heals?
Las Vegas Heals is to bring together the different organizations, healthcare organizations within Las Vegas. That includes hospital systems, all the schools of medicine, even down to home health, hospice, PCA companies. We gather the insurance companies. We bring them all to the table to have discussions to help advance healthcare here in Southern Nevada. We have existed for about 20 years. HEALS actually stands for Health, Education, Advocacy, and Leadership. So we look to tend to those different things within the different ponds of healthcare, or the different providers or the different companies that exist within healthcare, to help bring awareness to issues that we all face industry-wide, and then to help to advance solutions towards those different issues.
November and December are two of the deadliest months out of the year, the most dangerous times on the roadways as well. I'm sure that the people that you work with see the devastation firsthand.
Absolutely. The ER departments, I mean, we're all touched by these very sad stories. I think working in healthcare is a little bit different because when people speak of tragedies that occur medically, a lot of people speak about hearsay or things that they saw. Unfortunately for us, we are touching on these tragedies on a daily basis. I started in healthcare as a hospice and chaplain, and it was many times that I would, while walking the ICU, connecting with the case managers, that they would ask me, hey, can you come in and pray with this family? From the 1 October event where there was people that had gone through tragedy, all the way down to drug abuse and impaired driving, where you have to step in with the family. And as a chaplain, the hardest thing possible to ever say, back when I was a chaplain, and still am technically, one of the hardest things to tell people is making sense of somebody else's poor decision, and trying to find a plan or a purpose through that.
Our national president this year, Izzy, is from Rhode Island. Her sister was actually hit by an impaired driver. And unfortunately, her story, while it's very special, it's not unique in that many people have been touched, again, by the horrific loss or the horrific effects of being involved in a situation like this. And, you know, what I remind people of is it's not just the choice that you make to be the impaired driver, it's the effect that you have that's so far reaching, the effect on that individual you might hit. It's that individual that, you know, family has then been impacted, local community members, law enforcement. Again, we're talking about law enforcement in this setting. And, you know, so many times when you ask law enforcement, what's been one of the most humbling or one of the moments of your career you remember the most? It's that knock on the door, right? To make that death notification. And too often those are tied to impairment. So it is devastating, particularly when we lose a young person, because we know it's a life, it's an opportunity that's cut all too short for something that's totally preventable.
And there are many resources for drivers online, whether it be strategies for avoiding drunk driving or ways that parents can talk to their teenagers about this fight too, right?
Teens, parents, young adults, law enforcement, all of those stakeholders that I mentioned can head to our website, www.sad.org. There's a ton of resources there. Probably most prevalent is the document that really started the organization, our contract for life, the first of its kind agreement between a parent and a young adult that's designed to get the conversation going about how together they can keep that young person safe. So how you can make a plan if that young person is in an unsafe situation, whether that be a moment where they're impaired, they're with someone that's making poor choices, whatever it might be. There are talking points, discussion points for teens and parents alike to have that conversation and most importantly, get that young person home and out of that moment safely, which is what we care about the most. Again, follow us on social media. We're doing a ton of information, working with our partners at NHTSA, the National Transportation Safety Board, and MAD, Mothers Against Drunk Driving. A lot of other great organizations out there promoting resources, so I would encourage you to check them out also.
Honestly, for me, it's just planning ahead. A lot of us that work, at least in our industry, and I'm sure a lot of other places, you make plans to go to a party, you make plans to go to a gathering, and I know this year is much more limited, so hopefully those numbers will drop dramatically. However, when you're making plans, make them all the way to the end, right? I used to work in kitchens, and the chef would always say, finish strong, right? The last plate needs to be as good as the first plate. And if you're making plans, make sure that you plan all the way until you fall asleep. Plan the bottle of water next to your bed, whatever that may be, but make the plans thoroughly, counting on that things may change and accommodating for that.
There's no surprise when impairment happens. You can always plan ahead and make that plan of how you're going to get home safely. We live in 2020 or almost 2021 where there are a variety of options. Again, whether it's an app, a taxi, calling a friend. I have yet to meet someone who would not go pick up their friend if they got that call that their friend was impaired and needed a ride. So it may be a moment of embarrassment, but it can save you the harm and the heart loss, the heartbreak of hurting someone else or hurting yourself, and also the incredible costs of receiving an OVI.
Thank you for watching, and we'll see you at the Mob Museum soon.